Hello, everybody, and good morning. My name is Ricardo Cabrera, and I am the operations manager at the Latino Chamber of Commerce of Boulder County. And today we have our very best friend, Dr. Lizbeth Mendoza, and she is representing the Vaccine Equity Coalition. She is a co-chair, and this group is part of Boulder County Public Health. And we are going to talk today about some updated statistics about the progress of COVID and its transmission. We are going to invite everybody to go get vaccinated because it's what we need to do to help the little ones, and we'll talk more about that. And without any further ado, good morning, doctor. How are you today?
Hi, good morning. I'm very good, thank you. How are you?
I am doing excellent, thank you. And it was so nice to meet you in person last weekend in our food truck event over in Longmont. So it was a pleasure to see you and to continue working with you.
Likewise.
Excellent. So let's get to work. Well, why don't you give us a little update on the statistics of what COVID has done for us in the last week?
Yes, we have some good news and some other not so good news. So let's just share them all. So in the good news, we observed less cases this week. The rollout per day on the last 7 days was about 62.7 per day. And that's different from 2 weeks ago when we talked about 73 per day. And actually that was the last week, 73. Now we have 62.7. Now, when we talk about the cases over the week, the accumulated number is 165.24, which is lower. Nevertheless, this is still a high number for when it comes to transmission, to community transmission. So we're still in that red state, according to the CDC's. Of high transmissibility or transmission among our community. That's why we have to keep using our masks. I think this is important to say. I mean, thank you everybody that's using masks, because and starting to follow all these other measurements, because that's why we're seeing less cases now. So this is working, but still we need some work to do. Now, the highest numbers of cases, we saw them in people between 23 and 34 years. This is something that we have been seeing consistently over the past few weeks. Nevertheless, in the other groups of age, we saw a little drop the past week, and now this week, not along the last week. What I'm saying is, the last week we saw a little drop, and this past week, that number got stabilized for other ages. Now, when we talk by race and ethnicity, we still see that now we're seeing a little increase in the percentage among the Latin community. So we're seeing that over the last 7 days, the percentage of the 22% of our cases was seen in this group, in the Latin Hispanic community, which, if we remember, is represents around the 17% of our community. So we saw a little increase in that, in the percentage of cases. Hospitalizations, we have 55 people this week hospitalized, compared to 58 of the last week. And when it comes to kids in the whole state, the report was nine hospitalized kids that are confirmed COVID cases, and there are 33 under investigation. So that's still kind of high. Now, mortality, we have had 9 cases of deceased people since June 1st. The most recent was on September the 4th. When we compare with the country, we see that we have about 82 mortality per 100,000 people, compared to the national number, which is 203. So we are not really as bad in that sense. We're doing something good, people. We're taking care of each other good, but still we need to work, because we're in that high transmissibility and we want to take our masks off, then we need to lower that number. Now, in terms of the vaccines, in this week, we would like to talk about more absolute cases to have a better idea of how many people around us is vaccinated and how many people are not vaccinated. it's another perspective. So if we take into consideration that in the county we have around 327,000 people, and we know that 240,000, approximately 240,000 of them have received at least one dose. We're talking that about 73%, a little over 73% have taken at least one dose. Now, what is the percentage? How many people have already taken the full course of the vaccines, which is the main goal? That comes to 223,000 people. That's about 68%. So we're doing well, but we need to push it more and more. Now, again, now how many people out there have not received the vaccination in Boulder County? That's 87,000 people have not received the vaccine in Boulder County. Why? Because they are not eligible. Some of the people are not eligible. We're talking specifically about kids under 11, but also people who have certain diseases that kind of like preclude them from taking the vaccine, or people who have not yet taken the vaccine as a choice, or they haven't found a way to do it, something. Now, this is about 27% of the entire population. An important thing to say is, okay, so there's people around who are eligible and that is not vaccinated yet. How many are those? That's about 63,500 people, near to 19% of the people that are eligible but not vaccinated. So this is what we're seeing in terms of absolute numbers, just to have an idea, right? When we look at race and ethnicity in the distribution of the vaccine, we see that about 71.8% of the white population non-Hispanic in the county has received at least one dose. If we compare to the national percentage is 52%. So we're doing really good in this group. When we go and look at the Black population, we see 58% of this population has been, in Boulder County, has been vaccinated and received at least one dose, compared to the national, that is 43%. So yeah, good, we're doing good in there. When we go look at the people from Asiatic groups, we have 57.5% of this population compared to the 68% national. But when we go look at the Hispanic population, 41.4% of the Hispanic population in our county has received at least one dose, and the national average is 48%. So still, and we recognize that there might be some, like low registration or lower than it actually is because of the registration procedures, people not reporting as Hispanic, or the registrars are not reporting them as Hispanic, just white. We understand that, but still our numbers and in the national scene are low. So we still need to do some work with these communities, help these communities to get access to the vaccines. We know that minorities always have issues with access. So if we know somebody from these populations, let's help them to have access to the vaccine. And if you belong to this group, let us know what's going on, how can we help? That's the work of the equity group. What are the questions, what are the doubts, what are the confusions, or what are the barriers? So please approach to us, to your doctor, to whoever you feel the most confident that is a trustworthy source of reference and that can help you so that we can get your vaccine.
Excellent, excellent, Doctor. Where all this information that you're giving us is spectacular. It's incredible. And just to land this a little bit in a little bit of a summary, we are seeing now in September of 2021, a lot of, 62.7 cases on an average of a 7-day average per day. This is very similar to what we were seeing a year ago in September and October of last year. So even though the cases are going down this week compared to last week, let's not kid ourselves. We are still in a high state of transmissibility, and we still need to protect ourselves, by getting vaccinated, of course, and wearing a mask and social distancing and washing our hands as much as we can. And this is especially important because we are ultimately right now, our most important task is to protect the little ones. They can't get vaccinated. If you're under 12, that's 11, including 11 and younger, they don't have an option to get vaccinated. And all we can do is help them by helping ourselves, by protecting ourselves through the vaccine or through the masks. The young adults 23 to 34 is the second highest case count in the county, and those guys have an option. So guys, I'll talk to you directly. If you have an option, please go get vaccinated so you can help yourselves and your community, especially the little ones who don't have an option. You also shared with us information about 63,000 people that are eligible that have not been vaccinated. This is, amongst the little ones, the young adults, and the people that by choice are not getting vaccinated. So if we could convince you to go get vaccinated, please do it, because we are helping the little ones. This would be a selfless act that you are doing, because until we get that vaccine, and we don't have it yet, the young ones are the ones that are at higher risk, and it shows in the numbers. So with that, Liz, what'd you tell us about the booster shots and the progress for the vaccine for kids that are 12 and younger?
Yeah, so we talked about the boosters the other week. And so this week what we learned is that the advisory committee for the FDA did not approve the boosters for the general population. Nevertheless, they did advise boosters for 65 and older and populations with highest risk of contracting the virus, but also having a severe case of COVID. So this was the advisory committee. Now they of course gave advice to the FDA, and this week the FDA ACIP group are going to be meeting to finally say yes, we authorize or not. We don't authorize these boosters. So those who are still waiting, hold on until they officially say it is authorized. FDA says yes, it's a go. And then if you're 65 or older, you can start asking for your booster. And there's going to be, of course, they're going to release what are the conditions for you to do that, like how many months after your second dose or completing your second dose of Pfizer vaccine. This will happen also for Moderna and for Pfizer and for J&J at a certain time, but right now we're talking about the Pfizer specifically, Pfizer vaccine. And the same with Pfizer, they released the final data, the conclusions of their clinical essays. And so what they found, and they still have to submit all this information to the FDA to get it approved for kids, is that in this group 5 to 11, they were able to find a very robust immune response to the vaccine with a lower dose. So they were able to define the dose, and they were able to define the intensity of the immune response. So it's very positive. They are very confident that they will get an authorization, but that still has to be discussed by the FDA and all the review and all the groups that check on safety and efficacy and all that stuff. So they're thinking that by the end of October, they might have an answer for these groups, for these 5 to 11. And the other groups under 5, the clinical trials are happening, and we don't know yet. We have no idea when they're going to be submitting or when are they finishing with. We don't know yet. But the clinical trials are happening. The same happening for Moderna and J&J eventually. Mm-hmm.
Excellent. So, friends and whoever's watching, stay patient. There is progress going on with boosters and with vaccines for the young kids. Besides that, I'll do one more invitation for you guys to go get vaccinated. All the information that Dr. Liz is sharing with us is down here in the description of this video. You're going to find links to the Boulder County Public Health website, where you can hear and read about all the stats, information, vaccination clinics, and just so you know, vaccines right now are ubiquitous. They're everywhere. So you can go to a supermarket and get vaccinated. you can go to a medical clinic that you find in every corner strip mall and get vaccinated. They're free, they're anonymous. All they're going to ask you for is your name and your birth date, just so they can register it. And they're private, so there is no sharing of information if that is a concern for you. So I would say take a moment and help a kid, you know, because ultimately right now the only really vulnerable population that we have are the kids that are 12 and under, because they don't have the option to get vaccinated. So so let's help a kid and go get a vaccine for yourself. Besides that, I think we've covered our topic today. Liz?
Yeah, and just to mention, you know, that yes, it's very important to get vaccinated for the kids and the community. There's no doubt about that. And also for yourself, if you look at the statistics and the people that have been hospitalized lately with COVID, and that they end up having, you know, real severe complications or even death, are people mostly are the people not vaccinated. So, I mean, also, you know, you're caring for the rest of the people, just helping you with your friends, the same ages, you know, avoiding having to go through this bothersome, you know, of developing a severe case of COVID. So please, 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 if you have any questions, any doubts, anything you want to discuss around the vaccine, please, you know, by all means, contact us through the email or through the call center or with your doctor to discuss all these things that you might be encountering that make it a little bit more difficult for you to say yes to the vaccine. And let us help, you know, however we can, so that we can have as many people as possible vaccinated to protect the ones that who cannot get vaccinated. Mm-hmm.
Excellent. And with that, thank you so very much for all the information and your time. And we'll see you again in a couple of weeks.
Yes, thank you very much. Bye-bye.